Nearly 600,000 hernia repairs are performed each year in this country, but what exactly is a hernia and who is prone to get them? Dr. Peter Leff is a general surgeon at MidState Medical Center who has some answers for us. Doctor, welcome to Connecticut Style.
Hey, good morning.
First off, tell us what a hernia is.
Hernia is essentially a weakness or a bulge in your abdominal cavity. It could be down in your groin, it could be on your abdominal wall from prior surgery. Lots of people get them. Sometimes they'll notice they're looking in the shower, they see something, they see a bulge, and they say, oh, something's different here.
And what causes that?
What causes it typically is just a weakness. Us being vertical sometimes is enough to do it. Gravity, age, sometimes people who lift a lot, and other factors weigh into it.
Got it. Now, I understand that in the summertime, you see more cases of these.
Well, people are more active, and
they
want to be more active. And a lot of patients they come to me with a hernia. They say, well, golf season is kicking in, or I'm starting to run or cycling, and how can I get back on my feet fastest? And what's the best way to get back and get this thing fixed and move on from there?
Now, do you feel a hernia? Do you know something's wrong, typically?
A lot of times you'll feel a bulge, discomfort, uncomfortable feelings. Sometimes with athletes, certain moves they make, they'll say, well, wait a minute, something feels like it's catching or clicking. And a lot of times they'll have a little sports hernia or a little hernia causing their discomfort.
Can anyone get a hernia?
Anybody can get a hernia. Babies get a hernia.
Is that
There's
right?
really, unless you're too young or too old, there's really no reason. I mean, there's really, if you're too young or too old, you really don't have them fixed. But other than that, you should really get them fixed.
All right, well, let's talk about how exactly do we fix it? What's the process?
Traditionally, there are two ways to do it. A typical open procedure where you make just say we talk about a groin hernia that we typically think of a hernia as it's about a 6 centimeter, like 3-inch incision or so. It takes about 3 or 4 weeks to recover from that. You're sore and uncomfortable. The other way, which I prefer to do, if I can, is laparoscopically with little cuts or minimally invasively. You have a 1/2-inch cut and 2 1/4-inch cuts with the instruments that we see up front here, and on screen you make a little 1/2-inch cut. And the best analogy I could use is a hernia is almost like a hole in a tire with the inner tube going up through the hole.
Okay.
Or in the abdominal wall being the tire, and the peritoneum or the covering or the lining of the insides is the inner tube. So I work in a theoretical potential space, and the balloon that you see first dissects out a little space so I could work and essentially repair the tire from the inside.
And the tool that I have in my hand is actually
You're a surgeon
something
now.
I'm a
Right.
surgeon.
You're
No
a
one
surgeon
wants
now.
that, doctor.
You're a surgeon, and that's one of the tools we use to help manipulate, dissect out the space, and put a piece of mesh to basically patch your hernia.
Let's talk about the mesh because you brought a sample of it here.
Right. It's a polypropylene mesh. Your body scars into it. And typically what you saw in the video is once I get into that space, I essentially lay this down over areas that you get hernias and just patch it. It just lays in there. And in fact, if you had a hernia on the other side, I would just walk around the other side of the table, keep the same little 3 cuts, switch left and right hands, and fix. So if you've had 2 hernias, instead of having 2 6 or 3-inch incisions, you get a 1/2-inch and 2 1/4-inch incisions.
So I'm assuming, recovery time must be a lot quicker.
Recovery time is great. Typically, patients will do this on a Friday, and they're back to work on Monday.
Wow.
And you're usually just taking Motrin or Advil or Tylenol at that point. So you're back to work earlier, cuts are smaller, and really at the 2-week mark, there's no restrictions. Even 1 week, you could go play golf if you want. It might be sore, but
You could do it.
play
I bet
golf.
you people will try it.
They have.
Are there any reasons you would do it the old way?
Reasons to do the old way: if I have a patient who's elderly,
Okay.
or if they're very young, you don't want to do it this way. But typically, older patients, you don't want to have the risk factors of general anesthetic. I have to put you asleep to fix the hernia.
Got it.
Versus traditionally under local and sedation with the cut, you could fix it that way. And
It's not really that intimidating this way.
it's not intimidating nowadays. When we first started doing the repair, probably about 18 years ago, a lot of people were scared with the repair. It was a new space surgeons really hadn't entered before, at least not willingly. And to create the space to get in there, the repair we do now is essentially the same as done before, but we use a lot bigger piece of mesh. We've learned a lot over the years. And really, for the last 5 years, this repair is really at its best. It puts the mesh in the entire area where you could have a possible hernia. And you don't even miss hernias this way. When you do the traditional old-fashioned way, sometimes you'll miss hernias. This way you see everything patch it, and go home.
Very good. Doctor, tell us a little bit about MidState Medical.
MidState's a great community hospital. We're 150 beds. We all have private rooms. It's a wonderful place to work. It's really the place to go. It really is.
Great.
Everybody's friendly. You take care of your friends.
Pretty
your
easy to get
neighbors.
to, right? Right off the highway, right off
Easy to
691.
get to. Parking is easy, and for those who like Dunkin' Donuts, we got a Dunkin' Donuts in the hospital.
Even better, right?
Exactly.
Not bad. All right, let's put the information up on the screen. To check out MidState Medical Center, you could log on to their website, midstatemedical.org, or call 1-800-DOCTORS. Dr. Leff, thanks so much for being here and for the demonstration.
No problem. Thank you.
All right, up next, Chef Larry Landsberg shares a recipe for gazpacho when Connecticut Style returns. But first, take a look at this.